respect to the flu, every fall public health officials urge people to get the flu vaccine. And every year we're grateful for the partnership of healthcare providers in helping us administer the vaccine for people across Massachusetts. That includes hospitals, community health centers, and pharmacies like CVS. And this year that mission is more important than ever. As we continue to fight COVID-19, it's critical that we do everything we can to minimize the impact of the flu and other respiratory illnesses. This will keep people healthy and help maintain capacity in hospitals and other healthcare facilities in case there is another surge associated with COVID-19. Now, back in March, April, and May, we all talked a lot about the amazing work that was being done by the folks who are part of our healthcare community here in the Commonwealth of Mass. And time again, people would speak to the incredible performance, the dedication, the excellence, and the commitment that our healthcare workers were making to their fellow residents here in the Commonwealth of Mass. About a month ago, many of those same healthcare workers started talking to folks on our team about what it would mean to have the flu land at exactly the same time, a second surge for COVID-19. The point they made to us at that time was from a diagnostic point of view, from a care delivery point of view, from a capacity point of view, having the flu and COVID-19 surge in the Commonwealth at exactly the same time would be an incredibly difficult situation for them to manage their way through. And they urged us to step up our game, which is already pretty good relative to most of the states around the country, on flu vaccines. Now, I know some people are troubled by the fact that given the authority we have under state law, we mandated the kids and college students get a vaccination this year. But I have to come back to the message that came from a community that really put themselves on the line for the people here in Massachusetts at the end of last winter and through the spring, which was our healthcare community here, which said everything we can do to ensure that people are vaccinated for the flu makes their ability to do what they need to do for people here in Massachusetts through the flu season and the potential of a second surge can be done as well as it possibly can be. And we have an 81% positive vaccination rate for elementary school kids, right?
Yep.
We can do better, and we should. And especially with the return of so many kids to college, it's critically important that they get tested, or they get vaccinated as well. And I would just say to all of those folks in Massachusetts who admire, respect, and appreciate the heroic work that was done by so many people in our healthcare community last spring, that for them and for yourselves, you should go out and get a flu vaccine this year so that you and they can feel confident that as they deal with respiratory issues this fall and the potential of a second surge, more and more people in Massachusetts will have protected themselves from having the flu pile on top of a potential second surge associated with COVID.